I'm talking with Deidra Kindred, who is a nurse and also CEO of Your Nurse Advocates. Deidra has been a nurse for 20 years and started Your Nurse Advocates in 2019. Welcome, Deidra.
Thank you. So happy to be here.
Thank you for joining me. So, what does Your Nurse Advocates do?
Well, I'd like to start off by saying we are not a home health company, but we are educators, advocators, and navigators. We help you and your loved ones navigate the complicated healthcare system.
Wow, that's impressive. How do you help the patient? If you're the advocator, navigator, how do you help the patient?
Well, actually, that's a great question. So, what I found that in the healthcare system, we are lacking in our time that we take to educate you and make sure you don't return to the hospital, or make sure you understand your medications, or making sure all your doctors are collaborating. So, what a private duty advocate can do for you is help you be that guide. What's going to happen 3 months, 6 months, 9 months down the road? How are you preparing? How are you talking to your doctors? Do you understand your medications? So we have the time to sit with you and your loved ones and your physicians and talk about putting you at the center of your care. So that's so important.
Well, that leads me to the next question is how is your nurse advocates different from others in the space or from your competitors?
I'm so glad you asked that question. So, advocacy is really not a new concept. What it is a new business concept. So, as a private duty advocate, what I do basically, what makes us differ from other advocates that are my co-workers slash competitors, we are nurses. So you do not have to be a nurse to be an advocate. So what my cutting edge is that I have experienced nurses that are still working in the healthcare system. So if you or your loved one has a neurological problem, you're going to get a nurse that has that neurological background. If you're a diabetic, you're going to get a nurse that is specializing in diabetes education, or congestive heart failure, you'll get a cardiovascular nurse, or Alzheimer's, you'll get someone who is working with Alzheimer's clients currently. So that's my cutting edge is I want to make sure that you have a nurse that is still well versed in the system, and that's your advocate.
Truly customized
Right.
to their needs. And that just makes me think that that's probably something that your patients love about your service. And I have to ask you, what is it that patients do love about your service?
Well, they love the personalization. They love the fact that someone is listening to them and not putting them under an umbrella with everybody else.
Right.
I believe in holistic care. It's not just about the disease process and tunnel vision. It's about your whole body, mind, spirit. What is going on? How's your family dynamics? How is your mental state? So these things need to be addressed. I mean, you are a whole person. So there's a lot of things that go into play when it comes to your health care. So that's why my patients, my clients, I call them clients, my clients love me because, and they love the concept of the company because they feel like someone's listening to them and being in their corner.
Someone cares.
Right.
And we all do better when we know that somebody is in our corner, someone is looking out for us, someone that has our best interest.
Right. And it's so important because I know lots of times as healthcare providers, what happens is we're so busy, especially in the hospital or even the home health care setting. And we don't have the time to really get the full scope of the story because sometimes you won't get everything all at once. And how that particular disease process or processes are affecting that client. Everybody who's a diabetic is not going to have the same outcomes. And it's all about educating, right? So to me, it's about empowering you to make better healthcare decisions. So that's why my tagline is we equip you to make better healthcare decisions or better healthcare choices. If you're educated with evidence-based education that we get, and I can share that with you on a level that you can understand, then you're more apt to make a right choice for you.
Absolutely. And if you're equipping the client to make better decisions for their health, really that leads me to the next question. When does someone need an advocate? Is there a certain time or a certain point in the process?
Well, yesterday. They needed an advocate yesterday. The reason I say yesterday, because I'll tell you a story. I like to use stories. So my mother, um, at the age of 50, early 50s, before 55, because she passed away at the age of 55. But at that time, I was working in the cardiovascular intensive care. Very intense job. I was on a lot of committees and love educating other nurses that come into the hospital or that worked on the unit and da 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 da. But mom started developing the symptoms of it was neurological symptoms, and the doctors were saying, "Oh, it can't be MS because she's too old for MS because you usually get MS in your 30s. Oh, it can't be Parkinson's or anything like that because you usually get Parkinson's in your 60s. So mom, 70s later on." So they were like going back and forth. That was one of the most stressful times because you're so frustrated because one doctor says this, another doctor says that. Oh, let's do this testing, let's do that testing. MS and Parkinson's are both, they can have some of the same symptomology, but they're treated totally different on different ends of the spectrum. So the going back and forth to the doctors, to testing, it's like, oh, come on, make a decision so she can get treated, right? So they started treating her for Parkinson's, and they still were kind of doing the testing and rigmarole and going back and forth. And then they started finally treating her for MS. That was like an 18-month journey. On top of that, she had asthma, where during this time of year, she would have to go into the doctor's office to get allergy injections. And she also had colon cancer. So that's 5 physicians, right? So let alone her understanding the care, nobody was coordinating the care. So that's why I say people need it yesterday, because nobody's coordinating your care. When you're in the hospital, you got a clinical care coordinator, and you got your nurses and your doctors that are in the hospital, but they're not talking to your existing physicians outside of the hospital because they don't have time. So lots of times when you get released from the hospital, you go and you got to catch up all these other physicians on what happened in the hospital. So who's doing that for you? Right. Your daughter or son, who has to call and get off of work. They got to fight with their boss. They got to go back and forth. And this is what I had to do, because when I would go and ask for some time off, well, didn't you have time off last week? Oh, well, that was a different doctor. So it was just like, really? So I thought about, this is my personal reason for starting this. I thought about, man, if I could have had a neurology nurse go to the doctor's visit with my mom and then come back from that visit and telling me the good, the bad, and the ugly. Right. That was, so I can so we can make a decision as a family. And I would have paid for that service. So that's why I say yesterday.
And I have walked through that journey as well, what you have described. And I can tell you that until you walk through that journey, until you walk in those shoes, you cannot understand or appreciate how important an advocate is, just to pull it all together. And someone to speak on your behalf when you can't, or when a loved one can't, and someone that's just really looking to pull it all together, and someone who has your back in your best interest.
Or just to remind you when you go to the doctor, because I've done it before. I've gone to a doctor's visit myself, and you're thinking about this thing that's going on that you need to say it to the doctor, and you get out of the visit and you're like, oh, I forgot to tell them. You're not getting them back.
That's exactly right. Well, as our time is coming to a close, and it always goes so quickly,
yes.
How can people reach you at Your Nurse Advocates?
Well, I do free 30-minute phone consultations for anyone who has questions about my services or how they could fit. So that number is 817-854-3240. Or you can visit my website at www.yournurseadvocates.com. Or you can email me at Deidra, Deidra at yournurseadvocates.com.
Say that phone number one more time.
The phone number is 817-854-3240.
Deidra, thank you. I have really enjoyed it. And I've been talking today with Deidra Kindred, CEO of Your Nurse Advocates.
Thank you so much. This was great.
It was.